Hi, my name is Michael Villarreal. I'm a student physical therapist assistant at Concord Career College. And the topic of today's presentation is going to be the convex versus concave rule and some examples of open chain versus closed chain exercises. The specific objectives I want to cover today are going to be I want to explain joint arthrokinematics and the relationship it has to our movements. I want to discuss the convex versus concave rule as it relates to our skeletal system. And I want to discuss open chain versus closed chain movements. So before I jump in to the concave convex rule, I want to touch base and talk a little bit about arthrokinematics. Arthrokinematics refers to the motion that occurs within joint spaces during bone movements. Arthrokinematics is used to determine joint mobility and joint integrity. These movements are often referred to as accessory or joint play motions. Normal accessory motions are necessary for full and symptom-free osteokinematic motions. Now, osteokinematics are gross angular motions of bones around a joint axis, such as you have flexion, extension, abduction, and adduction. So if you think about it as going from gross down to fine movements, the osteokinematics would be the gross motions, the arthrokinematics would be the motions inside the actual joint capsule, and then the convex concave rules come into play inside that capsule. Now those motions in there, called accessory motions, are usually described as slides, rolls, or spins. As you can see here, I have a slide, roll, and spin on the screen here. So a slide is one directional uniform movement, sliding of one joint surface over another. The roll is like a rotary movement, one bone rolling on another surface. So if you want to think about it like a rocking chair and how it rocks over the floor, that's exactly what the roll would be. And a spin is just that. A spin is a rotary movement, bone spinning on another bone. Okay, so now that we've covered arthrokinematics, let's jump right into the convex concave rule. A law of joint kinematics that states that if a convex joint surface moves on a stationary concave surface, the convex joint will slide in the direction opposite of the angular motion of the bone. So an example of that would be the shoulder joint. As you can see in the picture here, it's the anterior view of the right shoulder. So as the right humerus moves up into abduction motion, you can see the head of the humerus roll up and it slides down in the joint of the scapula. Now let's go over to the concave convex rule. If a concave joint surface moves on a stationary convex surface, the articulate surface will slide in the same direction as the angular motion of the bone. So an example of this would be the elbow joint. So basically, if the moving joint surface is concave, the slide and the bone will be moving in the same direction. So if you look there at the picture of the elbow, you can see that the ulna and the radius are both concave and the distal end of the humerus is convex. So as it moves into flexion, moves up, you can see that the slide and the roll are in the same direction. So now let's take a look at a quick video explaining exactly what I just went over.
Hey guys, so today we're going to go over a simple, effective way to understand the convex-concave rule, especially for all you visual learners out there. The purpose of this rule is to understand the arthrokinematics, so basically the way different joints such as the shoulder and the elbow move. So let's define what each surface looks like. Here's the concave surface, and this is the convex surface. Find it easier to differentiate by thinking of the concave surface as the surface caved in. Now let's get into the rule itself. The convex-concave rule depends on which surface is moving. So let's look at an example of a concave surface moving. In the elbow, the ulna is concave and the humerus is the convex surface. As you can see, when the concave surface moves, the surface and the bone slide in the same direction. Now let's look at the convex surface moving instead. In the shoulder, the humerus, which is the convex surface, is moving on the scapula, which is the concave surface. As the convex surface moves down, the bone moves in the opposite direction. So basically, that's it for the convex-concave rule. If you have any questions related to physical therapy or the video, please leave a comment below. And thank you for watching.
So now let's move on to the last bullet point, open chain versus closed chain movements. Movements in exercise and rehabilitation can be divided into two separate categories, open chain and closed chain. If you would think of your body parts as links in a chain during all your movements, you think about like your ankle, your knee, your hip, all being different links in a chain. So during open chain movements, the distal end of the chain is free to move. During closed chain movements, the distal end of the chain is fixed to a surface. Let's start with open chain. These movements are performed typically where the arm or leg is free to move. They are typically non-weight bearing. If any resistance is added, it's added to the distal end of the limb. These types of movements are used to isolate a single muscle group. Examples of the open chain movement would be a long arc quad, bicep curl, or overhead press. Closed chain exercises. These movements are typically weight-bearing exercises, where participants can use added external weight or choose to use their own body weight. These motions are usually considered multi-joint movements. Examples of those would be squats, leg press, or push-ups. So now that we've seen a few examples of both open and closed chain exercise, it's important to understand the clinical relevance of both of them. Open kinetic chain exercises can be used to improve the strength and function of an isolated muscle or muscle group. So this can be beneficial early in a rehabilitation program or when improving aesthetics such as for a bodybuilder. However, closed kinetic chain exercises may be more beneficial in some circumstances. As far as closed chain motions, kinetic chain movements are often used to strengthen core muscles and stabilize posture. A benefit of closed kinetic chain exercises is that the movements they promote often relate better to activities of daily life, so they're considered to be more functional. Sometimes in rehabilitation, a person will use an open chain exercise to strengthen an isolated area, then move on to closed chain exercises. Now, the basis for choosing open or closed chain exercises depends on your overall goal for you or your patient. Depending on the potential benefits and or limitations of your patient, you can create a very specific, individualized rehabilitation program. Now, normal, everyday functional activities involve a combination of many open or closed chain motions. So both types can be successfully integrated to add diversity and still be appropriately challenging. So now let's summarize what we discussed today. We talked about arthrokinematics, which are the movements inside the joint. We covered the convex on concave and concave on convex rules. We also talked about open versus closed chain exercises and give a few examples of each. I do have a couple questions though for the audience. Number one being, if the moving joint surface is convex, what direction is this slide or glide in relation to the angular motion of the bone? Number two, would a biceps curl be an example of an open or closed chain exercise? So that's the conclusion of my presentation. I want to thank you for your attention, and I hope that you were able to learn some things today.